I'm Dr. Chung Yip. I work in Nexus Surgical Associates in Mount Elizabeth Hospital. I'm a liver and pancreas surgeon. Well, the liver is the biggest organ in the body, and it handles many functions. And because of its many functions and because of its exposure to the blood from the intestines, it can be damaged by many different insults. And these various insults can include pathogens such as viruses. It can include toxins like alcohol. And these days, fat in the liver is a big cause of damage to the liver. Tumors in the liver are usually rather silent because the liver is a very big organ. But when they get bigger and they cause a mass effect, the patient may feel discomfort on the right hand side of the tummy. They may cause pain in some cases. So treatments of diseases of liver, as I've mentioned earlier, there are two types of diseases, one pertaining to damage to the liver substance itself, and diseases which arises from tumors within the liver. So for diseases which damage the substance of liver, if it's bad enough, it leads on to what we call end-stage liver failure, and in such cases, the only treatment is a liver transplant. Whereas for tumors that arises from within the liver, it depends on the size of the tumor, the location of the tumor, as well as the health of the underlying liver from which the tumor has arisen. So these treatments will include things like surgery, and surgery can be either open surgery or laparoscopic surgery, which I will speak more about later. There's also other treatments that include ablation, and this you can think of it like a burning of the tumor with a probe that's placed within the tumor itself. And other treatments would also include things like chemotherapy and radiotherapy directly to the liver. With regards to surgery to remove part of the liver, which is liver resection, there's an open surgery as well as a laparoscopic surgery. Laparoscopic surgery has the advantage of minimal access. The wounds are much smaller, the pain is a lot less, and the recovery from the surgery is a lot better as compared to open surgery. And it's just as efficacious. And this is a procedure that is undertaken increasingly in these days. So laparoscopic surgery of the liver, bile duct, and pancreas, these are very technically challenging and complex procedures. However, there are many advancements recently that has made this procedure a lot easier for our surgeons. And these advancements will include advancements in the equipment that we use, the laparoscopic equipment, the energy devices that we have, and other devices such as ultrasonic dissector that we use to cut through the liver. In addition to that, advancement in video system. We use 3D systems to help us visualize better. We have better appreciation of the depth of the surgery, and this will lead to better eye-hand coordination and improve outcomes of the surgery. So the risk for liver transplant pertains to the actual surgery itself. In the short term, complications that might arise from the surgery. And in the long term, we are looking at not just complications arising from surgery, but also complications that may arise from immunosuppression, which is needed for a person undergoing liver transplant. So in the immediate period where we have complications of the liver transplant, then we are looking at whether the liver transplant is working, the graft itself is working. And because we need to connect up the blood vessels, the bile ducts, there can be complications pertaining to these connections that will be part and parcel of the transplant. In the long term, it's immunosuppression. Immunosuppression can lead to onto complications such as infective complications, as well as development of secondary cancers. Liver transplantation as well as liver resection, these are both very complex surgeries. And being complex surgeries, we would need skillful team. And this skillful team is a multidisciplinary team that includes not just surgeons, but other disciplines that support the management of these patients. And these specialties will include things like hepatology, as well as infectious disease and anesthesia, for which the anesthetist is subspecialized in looking after patients with undergoing a liver transplant or liver resection. So we have this team in Mount Elizabeth Hospital, and it's a team that works very well together. Well, I think the liver it's an amazing organ. It's an organ that can regenerate itself, and by looking after the liver, the liver can serve us well for the rest of our entire life. In fact, the liver is a youthful organ, and we have transplanted patients from diseased donors that are 70 years old, 80 years old, and the liver is still functioning great in the recipient. So it's take care of the liver, and it will take care of you. A healthy lifestyle is important. As I mentioned earlier, the liver is subject to many insults, of which alcohol might be one of them. So drinking moderation. The other big factor of chronic liver disease these days would be fatty liver disease. So a healthy diet is important, together with exercise, and in some patients or in older patients, regular health screening might be able to detect health diseases earlier, liver diseases earlier.